Yes, we are starting the recording. Yes, so Kukuapa, whenever you are ready.
Ready? Okay. Namaskar. I hope that all of you are staying safe and healthy given this unforeseen time as the world continues to go through the pandemic. I would like to take a moment to thank all of the global healthcare workers, doctors, nurses, and first responders who are putting their lives on the line to help save the rest of us. We must do our part in the fight against COVID-19. I implore you all to continue to stay home, follow the health protocols, actively practice social distancing. At this time of extreme variabilities, the OSA family is blessed to have access to experts who are part of the OSA Health and Wellness Group. I am requesting Dr. Devasis Ray, the chairman of the Health and Wellness Group, to take over. Thank you.
Thank you, everybody. Can you hear me? Awesome.
Yeah. Yes.
Okay. My dear brothers and sisters, a very good afternoon to you all. I, Dr. Ray, chairman of the OSA Health and Wellness Group, welcome you all on behalf of OSA and OSA Health and Wellness Group to this live informative session of COVID-19 apocalypse updates with question and answer sessions. I request to start this with a silent prayer for 10 seconds for all those who couldn't survive this apocalypse and those who are seriously fighting this out. So I will start 10 seconds silence for now. Thank you all. As you know, we are all super loaded with information 24/7. This session is a humble attempt to, number one, simplify the updates and join you all to discuss our questions and take your questions and discuss the answers as a group, as a family. At this moment, I would like Mr. Utkal to chip in to explain to you all the logistics. Thank you, Utkal.
Thank you, Dr. Ray. Quick logistics, since this is a video conference, being good citizen will help each other. So what has happened is that as you attend, you will see that you are joining muted, and we expect you to stay muted for the first presentation time at least. And then when you have to ask a question, unmute yourself using this Zoom's unmute feature, ask the question, and then do not forget to turn back the mute. That will help everyone to be able to hear. Sometimes the little noises like paper moving and things like that, that gets picked up. Background noise, which we are used to, that gets picked up. So please remember to keep yourself muted when you are not talking. And we wanted to go live on Facebook. Looks like Zoom is overwhelmed with the amount of requests because of everybody trying to do remote. So it's not letting us go on Facebook, but we keep trying that in the background. Otherwise, the choice is that we have a recording, which we can post later to YouTube and Facebook channels so that this can be viewed. Okay? Apologies for the technical difficulties on going live on Facebook and YouTube. At this point, you can also message your questions using the Zoom chat, or you can email us at osaec@odissasociety.org. All the bottom three options are available to you on the screen that is showing. You can post via Zoom chat, which is most preferred, or email, and it's not going live, but any point it goes live, you can submit via Facebook, or in Facebook, you can go to Odisha Society of America's page and write it as a message there. We will pick it up from there. And then for the first 15 minutes, we will have the conversation. Many of your questions will be answered there through the course. So please, let's not interrupt during the first 15 minutes. After that, it will be open for Q&A, and we will have a lot of time to answer all your questions. Okay. Okay. Back to the verses.
Yeah. Thank you, Utkal. And can everybody hear me? I got some text that some people cannot hear me speak. Okay. And I think we have the recording, right? We can post it. If somebody can't hear, please, I apologize. So, okay. So now I would like to tell you all the names of the speakers. The first one will be Dr. Nitin Doshi, cardiologist, then Dr. Sunita Kanumari, allergy immunologist, Dr. Shurya Nalani, internist from Michigan, Dr. Sangeeta Pradhan, internist from Michigan, Dr. Vikas Agarwal, internist from Michigan, Dr. Samarendra Mishra, ID, and one of our panelists, Dr. Vijay Thomas, MD, family practice from Texas. And so saying this, I would like to put the disclaimer in front of you. All this attempt is not a medical advice, just an information and awareness for you all. For medical advice, please call your primary care doctor. So saying this, I would say that let's enjoy the session, and I'll give the mic to Dr. Nitin Doshi, our beloved senior most member of our panel. Thank you, Dr. Doshi. Take it from here. We can't hear him. Yes.
Can you hear me?
Yes.
Okay. Thank you, Devashish, and good afternoon to everyone, and namaskar. I will start with briefly mentioning the present status and extent of this COVID-19, and then outline the management, which will be further elaborated by other members of our panel. The coronavirus pandemic, as we know now as COVID-19, was announced as a pandemic on March 11 by WHO because of its nature and extent of the spread around the world. Now it has spread to about 200 countries. Now, sometimes people have a question, why endemic and pandemic difference? Pandemic is actually the widespread global outbreak of disease, which is sustainable and spreads in many individuals at the same time. Now, the USA has surpassed almost all of the countries in number of affected individuals diagnosed with this virus. And it stands at this morning about close to 123,000 and still growing. And the death has been over 2,000. So that brings us to the management. This pandemic is being managed basically in four fronts. First one is containment. Second is diagnosis, treatment. Third, mitigation and control. Four, prevention. And I'll briefly go over individually, but then our other members of the panel will elaborate those. One, containment. This is basically closing the borders and the movement of the people across the country, state, city, county lines. And this has been very successful at the Wuhan in China. And now they do not have any new cases. The only few new cases they have found, they are mostly from imported. None are local spread. So that is the one thing that really was the benefits of closing all the borders. And as you can know, now the different states within our USA have closed their borders. Such as an example, Florida does not allow people coming in from New York, New Jersey, or Connecticut. And if they come, they have to go on quarantine for 2 weeks. So that has really helped to contain. Two, diagnosis and treatment. Diagnosis is obviously made by having different test kits. Initially, there were not as many available. Now it is not freely though, but still widely available from different manufacturers. And the last one approved by Abbott, which can be done at the point of care, and the results can be obtained in 5 minutes. And they've been going on a heavy scale production line. And the treatment I will leave it to Dr. Sangeeta Pradhan, who will be going over that. Three is the mitigation and control. Mitigation and control, again, depends on how you quarantine if you're mild symptoms with diagnosis or hospitalized, as well as the medical treatment. For prevention, I like to spend a little bit more time in prevention, as we all know, we all have to do our part in preventing the spread. So before getting into this, we need to understand the nature of the virus, how it spreads and thrives. It spreads in a droplet form as aerosol in the air. It floats around in the air for some time, and then it settles down on the surfaces. So mainly it is transmitted through the droplets generated by infected person who speaks, coughs, or sneezes. And usually that blast goes up to 1 meter or 3 feet, and sometimes it has been detected up to 6 feet. And that's the reason why we have to have the social distancing about 6 feet. So once we understand this, how the virus spreads, we'll be better prepared to follow the guidelines and knowing the reasons, and then we can follow appropriately. So first one is, as I said, about the spread by the droplets. And how do they thrive? As a droplet form, it thrives 3 hours in the air. On the copper surface, it lasts for 4 hours. On the cupboard or cardboard, it lasts about 24 hours. And a plastic or steel surface, it can last for 72 hours. And at times, it has been detected even after a few days. So number one is a social distancing. And that is, we keep apart, at least 6 feet apart in between the individuals, but not isolating. We can freely use FaceTime and other devices to be part of the group. 2, hand washing, and that is the most important part of the entire prevention process. Hand washing, one must do for 20 seconds. And again, you can look at the different video in the matter of time. I won't go into that, but at least 20 seconds, and you must wash all the fingers, hands, the outside of the hand, palms, and everything for 20 seconds. 3 is avoid touching face, nose, eyes, especially when coughing or sneezing. Cover your face with a tissue, and then throw the tissue right away onto the trash. 4, use of hand sanitizers as well as sanitizing wipes. Again, most important part is it must have 60% or more of alcohol content. So whenever you buy any hand sanitizers or wipes, it must be must be more than 60% of the alcohol contents. And 5, avoid touching multiple surfaces if you could, and use judicious use of sanitizing wipes. And last one is a vaccine. And again, I will leave it to our future or for other panelists to go over the vaccines and the development of the different vaccines. Now back to you, Dr. Ray.
Thank you so much. Can you all hear me? That was a good presentation, Dr. Doshi. Next is Dr. Sunita Kanumuri. Dr. Sunita, can you hear me? Dr. Kanumuri.
Is muted.
Can you hear me?
Yes.
Yeah.
Okay. So today, everybody must be wondering, can I get tested or not, and who should be tested? Presently, considering there's a lack of testing kits or lack of having enough testing kits, the priority is for people who have symptoms like fever, cough, and shortness of breath. So mostly people are hospitalized, and healthcare workers who have symptoms are the number one priority. So what happens to the others? So people who are at the highest risk of complication of infection and on triage, if they are positive with symptoms, or patients in long-term care facilities, or patients with 65 years of age and older, and they all have symptoms, they're all a priority, second priority to be tested. The first responders with symptoms are also in the second priority to be tested. Now, people who are in the community, because as we all know, it's become a community disease, to decrease the spread in the community and to decrease the hospital admissions, if they are critical infrastructure workers with symptoms, or if they do not fit the above category but have symptoms, or healthcare facility workers and first responders with symptoms, they would all be included in the testing. And also in individuals with mild symptoms in communities experience high numbers of COVID-19 hospitalization, they would also be considered for testing. But again, testing is actually at the discretion There is a CDC guideline, but it's at the discretion of the state guidelines again, and also for the clinician. People who do not have symptoms at this point, they're not being tested. Thank you, Dr. Ray.
Thank you so much. Dr. Surya Nilani. Is she muted?
Yes, I am. Hi, good morning. Namaste. I'm Surya Nalani from Troy, Michigan. I will be talking about the prevalence in younger population, whether there's any chance of reinfection, and the prevalence of new strains which are coming up in the community. We have seen that the people at most risk are the ones who are 65 and above, with or without comorbid conditions, like with who are having diabetes, high blood pressure, any lung problems like COPD or asthma. But according to the new CDC report, it has been seen that this virus can affect any age group, more so in the younger population. In the graph shown in the here, which initially 80% of the deaths, 50% of hospitalizations, and 50% of ICU visits were more prevalent in the 65-year age group. But now you see 20% or a quarter actually in the 20 to 44-year age group. Now, true, this is a pandemic, so we'll have more and more testing, so more people will be positive. But what is the reason? That's because, like one of the panelists said, it's difficult to contain the younger population, which means that the concept of social distancing. Social distancing was a concept which was initially adapted in the 1918 influenza pandemic. Next slide. And at that time, they realized that because of the exponential increase in the virus, they actually saw that when people maintained a 6 feet distance or a 2-meter distance, the aerosols from an infected person, either while talking or breathing or coughing, doesn't fall on the other person and decreases the risk. So social distancing, along with lockdowns, had shown a predominant decrease in mortality. This is exactly what Andrew Cuomo, the governor, has suggested that 2 days ago. The initial rates of hospitalization and the hospital visits were actually doubling every other day. But now it has come down to every 4th or 5th day, which is actually not, it looks still bleak, but still a little bit light at the end of the tunnel. The question we have is, once we are infected with the virus, is there a chance of reinfection? Now keep in mind, once we are, there's a very small study in monkeys, which they showed that the monkeys which were reinfected with the virus at day 28 did not show any new symptoms. Now in humans, once we have the virus, our body actually responds by causing antibodies, or they call immunoglobulins. That gives us long-term immunity and confers. And that's why there's a vaccine which is in trial. However, the data from CDC is still ambiguous, and that's because there's newer and newer strains which are coming up. That brings us to the question of, are there mutations? The answer is yes, there are new mutations for the coronavirus. Any virus, once it gets into the respiratory tract, whether it's the nose, the throat, or the lungs, it replicates. That's the history of any virus. However, coronavirus is a bigger virus than the influenza virus. So it actually proofreads itself, which means that it's less adaptable to multiple mutations at the same time. According to a small study, there are 2 virulent strains, the L strain and the S strain, and the L strain is a little bit more aggressive. However, again, the reports from the CDC says that these newer mutations are not causing new infections at this time. Thank you for your attention.
Thank you, Dr. Nalani and Dr. Sangeeta Pradhan.
Good afternoon, everyone. I'm Dr. Sangeeta Pradhan, an internist practicing in Rochester Hills, Michigan. Welcome. I'll be discussing the treatment aspect of COVID-19. So if you are asymptomatic, which means you don't have symptoms, please do not worry about the treatment aspect. If you have symptoms, isolate yourself. Preventively, you can take vitamin C, D, and zinc to build up your immunity to deal with the disease better. Rest, hydrate yourself, lots of water, and Tylenol is a safe medication to take in COVID-19. Please don't panic. It's a very stressful situation for everybody, a lot of anxiety, fear of unknown. Most of us have a good immune system and we can get over this condition even if we contracted it. So just think of the people who are in the front line, treating the sick patients and what they are going through. Stay active, exercise regularly, do yoga, stay connected with your friends and family virtually. Practice mindfulness. So who are the people who are at high risk? Who should be more careful, more cautious? Healthcare providers, age more than 65, 70, underlying lung condition, immunocompromised people, especially the ones who are on treatment for cancer. Next slide. So there are some don'ts that you don't want to do. One, avoid prednisone. Avoid non-steroidal anti-inflammatory drugs like ibuprofen, naproxen, trade names being Advil, Aleve, Voltaren, Brufen, any of those medications. Antihypertensives, if you're already on an ACE inhibitor or a ARB, which is a medication which I'm sure most of you, if you're on it, you know what they are, losartan, valsartan, lisinopril, those kind of medications. If you're already on it, don't worry, don't have to stop it, but somebody should not start at this time. One request to everyone, please do not ask your friends or family members who are in healthcare for prescriptions just because you are panicking. You don't need it. And we have been recommended for all my physician friends from the licensing authority not to prescribe unnecessarily. So what are the medications that help? Still, there is no proven definitive treatment. However, there's lots of trials going on and lots of medications are being given. So there is a trial with chloroquine, and there is also combination of HIV, ritonavir, lopinavir with beta-interferon, and also another medication is called remdesivir. There are a lot of other trials going on in the horizon, like convalescent serum from the patients who have recovered from COVID-19. So at the end, there is hope for everybody. There's a lot of things going on right now. Let's hope and pray that we tide over this curve and hit our plateau soon. Thank you for your attention.
Thank you, Sangeeta. Dr. Bikash Agarwal.
Namaskar. This is Bikash Agarwal. Actually, I'm practicing in Indiana, not in Michigan. So I'm going to talk about the healthcare, how it has changed in the last few weeks. I mean, as you all know, virtual medicine, telemedicine has come up big time. We are maintaining a social distance, but not social isolation. There are many insurance companies helping us not to get any prior authorization, which we used to deal with it, and many new innovation to cope up the demand for ventilators, PPE, and 3D printing. And I'm going to talk about briefly about testing. There are two types of testing. One is the RT-PCR, which is usually done initial infection phase. And one of the newer tests which came out, which is testing part of the gene rather than the whole gene, which we are testing initially. And then second type of testing is serological testing, which is usually useful after 7 to 10 days of acute infection. And then I'm going to talk briefly about the clinical trials. There's two types of clinical trials going on. One is the preventative trial, which is mostly for people who have high exposure and high risk post-exposure trial to prevent the disease. And two medication has been in the trial. One is the hydroxychloroquine, the other one is losartan. Losartan is controversial, as Sangeeta mentioned, that we should not start because of the ARB2 receptors where the virus get attached to and give us the infection. But it also has some benefits to prevent that infection. Second trial is the treatment trial, which Sangeeta showed the slides. Most of those medications are either anti-malarial, antiviral like HIV, and the two most promising antiviral, which is coming up, which is remdesivir, which was tried at University of Nebraska for Diamond Cruise passengers, and they had some success. And Washington State also, they used this drug with good success. But unfortunately, it's the intravenous drug, and most of those trials were in moderate to severe patients. There is another sister drug, which is called favipiravir, which has been manufactured by Fuji company, Fuji Film from Japan, and that's the oral medication, which has shown some success in China. The other ones are the convalescent serum, monoclonal antibodies, and immunoglobulins. And finally, the vaccines, which has been funded by Bill Gates Foundation, and a big university trial going on in the state of Washington. The good thing is the virus is not mutating as much. So hopefully we will be able to have a vaccine, which is a new technology they had adapted with mRNA, which doesn't take that long to produce the vaccine. And we hope we will get up and marketed within a year time. And the results we are hoping to come sometime in end of April to first week of May because of the caseload. And I'll end there. And if we have any other questions specific to the clinical trial, we can answer those during our question and answer sessions. Thank you.
Thank you, Dr. Agarwal. Now we have a guest speaker, Dr. Samarendra Mishra, who is an infectious disease specialist from Gurgaon. And he also is working with the COVID-19 project in India too. Welcome, Dr. Mishra.
Good evening, everybody. Thanks, Dr. Ray. I'm Dr. Mishra from Gurgaon, as mentioned. I'll just give, I don't have any PPTs. I'll just give an update on what's happening in India. We have some positive news and we have some not so good news. The bad news is that our information overload has caused a lot of panic. All our media channels are focusing a lot on what needs to be done more, what needs to be done more. So that's where people, I mean, the government has appealed to the media houses to don't give so much of information overload and please step back a bit. On the positive news is that we just crossed today, the infection rate is, I mean, the positivity is only about 1,000 plus. Mortality is around 27. Nobody knows why and how, but we have been under a lockdown, countrywide lockdown, and most of you, if you know India, it's a very diverse, very mobile country, and people have still been moving in spite of the lockdown. But more or less for the last 5 days, it has been more or less successful. All our international borders had been closed for quite some time now, and all flights, international and domestic, have been grounded. We have already started a telemedicine because we don't want the infection to reach out to the rural areas. So through a telemedicine from Delhi, most of our doctors and nurses are being updated on infection control, the treatment protocol and guidelines. So we are getting prepared, and we are hoping for the best that things don't go out of hand, which is, I mean, to most of us, it's very positive because in a country like it spreads fast, goes into millions. And regarding the treatment, all this has been discussed. We follow the same WHO protocols. We have had some success in the rapid test kits, and a couple of Indian companies have come up. MyCare, which is similar to the Abbott thing, which would be very soon available for commercial use. So we are hoping to scale up the testing and the quarantine measures, and hoping for the best. So stay safe, and all your friends and colleagues and family members in India, just to assure them that India is still a little ahead. Thank you so much.
Thank you, Dr. Mishra, and I hope you all stay back for the question and answer, which is the next session. It's the most interesting one. We leave it to the audience, and We'll follow whatever you guys want us to answer and try to clear it out. And let's start the question and answer sessions.
Okay, so we'll
Pardon
first
me?
take the submitted questions first. So all the audience, please have presence. Once we take the submitted questions, it will be open for all. At that point, you will unmute and ask your questions. Okay? So Dr. Ray is going to go through those questions which are already submitted.
Excellent. So the first question is, despite lockdown, majority of us have to go out to get essentials from the stores, order stuff online. What precaution we must take to reduce the risk of getting the virus? Dr. Sunita Kanumuri. We can't hear you. She's muted.
Give me 1 second.
Okay, thanks.
So I'm going to unmute all the panelists at this point. If you want to go on mute, then use your discretion.
So we all need to bring our groceries and other essentials from the stores, and some are being actually delivered to the doorstep. The recommendations are to, since the virus is active for 3 hours at least, so leave your goods either in the garage, or if you don't have a garage, like outside the door. The virus, based on the surface that it's on, it can last anywhere 3 hours to 24 hours. Now, for other groceries that are frozen packets or so, you can wipe them with soap and water, and then you can put them in a refrigerator. And if they are vegetables with hard surface, same thing, wash them with soap and water. And make sure you wash your hands after you have handled all your groceries.
Thank you, Dr. Sunita. The next question is, what are some of the key constraints for USA from testing more people compared to some other countries? We have found better control. Dr. Thomas?
Yeah, I think, thank you, Dr. Ray. The problem in the US is we didn't have initially the testing kits available. So we lost the chance to test the early cases. And the problem is from that, we kind of got a whole bunch of new cases. So now the good thing is test kits are more and more available, and with the new test, which Abbott just released we just got a 15-minute turnaround, it'll be really good to have it in the community to test people. And I'm hoping that hospitals and maybe the clinics that are still open will actually do the testing. The problem now is almost all physicians have gone to a tele mode, and they don't see people in the office. So we need to have like testing like places that's basically either in a hospital setting or some tents outside. And I think in this week and next week, we'll be seeing a lot more of those happening. And hopefully we pick up the cases and kind of go from there. Anyone else can add to that? Sure.
Anyone else wants to add to that, or we'll go to the next question? Okay. The next question is, we hear about flattening the curve of rate of spread. How can our curve be flattened quicker? Dr. Pradhan?
So very simple, honor the quarantine, stay home, wash your hands, do not step out of the house unless it's absolutely necessary. Do not let anyone into the house either.
Thank you. Next question. How long after the virus contaminates, it stays in your body? Dr. Kanumuri.
So patients who, I think usually the incubation period is 2 to 14 days. But by the time a patient develops symptoms, it could be close to 3 to 5 days. So they say if you're in touch with a person who's asymptomatic but develops symptoms later, you have to be careful. They may have been symptomatic 3 days before that, and 3 days after your fever breaks or your symptoms, not the respiratory, but the fever breaks, that you're still shedding, but there are new studies that are saying that they could be shedding for more than 2 weeks.
Thank you. The next question is, what's the latest on the progress of medicine that we hear around hydroxychloroquine being used for treating COVID-19? Dr. Pradhan?
So basically, it's still in an experimental mode, but however, we have seen from many tests and studies that it has been effective. So for the lack of a better choice, yes, we are still using it in symptomatic patients, and we are seeing some good outcomes.
Thank you. Next question. This is Dr. Mishra. Any thoughts on why India has been able to control the count of patients despite the huge population?
Yeah, that's $1 million question. Who has that answer should be in line for the next Nobel Prize. But three things. The first one, which is very obvious, we are just picking up. We could see the same curve as in the rest of the world. That's one. Second is, if it is under control, if we are still in stage 2, it could be that a lot of measures were taken much in advance, like the international borders, the airports started screening much before the first case was detected in India, right from in December. Second thing is people, as I said, with panic, the quarantine is working fine. People have the social distancing, etc., has started much earlier, almost a month earlier. So that is where people have been a little compliant and adherent to guidelines. The third thing I think is there is a few questions asked on malaria. It's too early to say. They're saying that malaria endemic countries have not been affected, but if you look at Thailand and all, they are reporting quite high cases. So that's something which I would not comment upon at the moment. But then basically these are the two things which are showing some kind of a success.
Thank you, Dr. Mishra. There is a related question for Ms. Swati Mishra. Some reports are saying anti-malarial drugs are possibly working for COVID-19. Does it mean if a person had malaria before, should he be having antibody to fight this virus now?
Too early, and I don't think so. Why we are a little cautious about this is the moment these things leaked out, the normal chloroquine and anti-malarial drugs went out of the market. People started hoarding. But as of now, there is no evidence to show that chloroquine or anything, there's any protection due to malaria.
Thank you for that, Dr. Mishra. The next question is, can a patient gets virus again in future after getting infected once? What other precautions should be taken by such patient after getting cured? Any recommendation for medication to get out of tiredness and weakness? Dr. Thomas.
Yeah, that's a good question. Actually, I don't think we've seen any reinfection yet, but there may be a few anecdotal cases in China. And the big thing is to actually boost the immune system. So what I would do is actually do all the right things first, like stress reduction, eating right, exercising, take your vitamins, vitamin C, vitamin D, and hopefully you get the infection, your immune system is good enough to fight it off and you don't get reinfected. If you do get reinfected, I guess symptoms may come back, it may be minimal. But again, we have to still go with the basic, the core symptoms. That's cough, fever, and trouble breathing. So if those come back, you have to be kind of calling your physician back and maybe getting retested. You know, thing is, it can happen, but it's rare. We don't know, so we'll have to wait and see. But I think the key is to really kind of beef up the immune system, so you really kind of fight it well.
Thank you. Thank you, Dr. Thomas. The next question is, if tested positive for COVID, should I test again to ensure I do not have a virus left after 14 days? Dr. Vikash Agarwal.
Really, there is no good guidelines about that. And if they have no symptoms for 3 days of not taking any paracetamol or ibuprofen, and they don't need to, but they need to take all the precautions as if they have that infection up to 14 days, because the infection can flare up to 14 days and cause major problems even after 5 to 10 days. So they have to take all the precautions, but there is no need for testing per se. But again, they work, every company have their own rules, and to go back to work, one path, you need to test 2 negative 24 to 48 hours apart. The other one is go with the symptom control and go back to work. But the serology testing will also help us and change that guidelines in near future.
Okay, thank you, Dr. Vikash. The next question is, what is the earliest time the virus can be detected? Can it be detected before all visible symptoms appear? Anybody wants to take it? Dr. Doshi?
Yes, I think during the incubation period, the virus lives in the body. However, there is no way of finding it out because you are asymptomatic. And if you are asymptomatic, there is no need to do any tests. So it's very difficult to say whether you have any virus in your body. The only way you can do is to, if you are exposed to any individual, then follow the quarantine rules.
Exactly.
And
Thank you so
Yeah.
there is prevention trial, and they can enroll in the prevention trial if they have high risk exposure with 2 medication, hydroxychloroquine or losartan. And I can give that information. It's open to general public now.
Okay, thank you so much. So the next question is, how safe is takeout food from the restaurants? And that is Dr. Surya Nalani.
Yeah. So it's absolutely safe to, to take out food from a restaurant. If the food is in a brown bag, you discard or recycle the bag, wash your hands, take the food out from the brown bag, and you can heat it up or microwave the food for 30 seconds, and that will actually kill the virus or the bacteria. But washing hands is the most important before you touch the food.
Thank you. There is a related question, and this is from Kiran Biswal. How do we treat vegetables and groceries that's delivered to the doorstep? Vinegar wash is fine? Question. Dr. Pradhan?
Yes. So vegetables, every grocery that you get, the virus is known to stay on the outside paper and cardboard for 3 days. So a non-essential stuff, you can just leave it in your garage. Once you get home, get the vegetables, treat them like your hands. Wash every possible vegetable and fruit or plastic packaging with soap and water for 20 seconds, and you're good to go.
The next question related was, is vinegar wash is fine? So what I have heard is, there is no proof here on 100%, right. But they said is, you don't have to use vinegar to wash your vegetables. You can dilute with water because your vegetables can taste, vinegary taste. But there's nothing, no additional safety measures based on just washing with vinegar.
Can I add to that?
Sure, go ahead.
Yeah. Thing is, I know the one thing is very dilute bleach water can be used to wash some vegetables, and you can actually wash it and then neutralize it with vinegar. So that might be an option. Because CDC's got they give you how to make the Clorox dilute bleach solution, so you can use that to actually wash some of your fruits and vegetables, and then you can actually use vinegar to neutralize it, just a dilute form of vinegar.
Right.
Let me add to that. It's 1 cc of bleach to 50 cc of water to make the dilution.
Excellent.
Yeah. Once again, tell the ratio.
1 to 50, 1 cc of bleach to 50 cc of water.
Yeah. So it's kind of 1 liter of water and about 30 cc's. That's what I read of bleach. Yeah, that makes a really good solution.
Excellent.
And it should be at least above, I think, 0.12%. Yeah.
Thank you. Now, there's a related question, Vijay or Sunita, you can take. Is Dettol a good sanitizer given that hand sanitizers are not available back in India?
Let me take that. Actually, it is because in India, we used to use it growing up. And as a matter of fact, when they told us that we may not have enough alcohol, we did buy some Dettol, which we can use in a little diluted form.
Can I add to this?
Sure, sure.
Hand sanitizers are quite easily available. There had been a bit of a hoarding by some of the retailers in the middle, but hand sanitizer easily available. But our emphasis has been soap and water. That's the best thing anybody can have in the days of lockdown. So we are promoting soap and water hand wash. And Dettol has, I was going through the literature, a couple of products have anti-corona activity, but the Dettol which are available in India at the moment, they don't claim to have anti-corona activity.
Thank you so much. So let's move to the next question is, can we get packages shipped from China? Dr. Thomas?
I guess I'm not a big fan of China, so I wouldn't really get anything shipped out of China. But yeah, we have stuff coming in. The good thing is it takes at least a week to come in. So I'm assuming whatever virus is on the box should be gone by then, because usually dryness and heat kind of dehydrates and kills the virus. So definitely it's safe. So I think I don't think there's a concern. Anybody wants to add?
May I add something?
Sure.
Actually, I was listening to a Q&A by Dr. Fauci. He's a very famous person from the federal government. And somebody asked this exact question to Dr. Fauci, and he answered, it is ridiculous. I mean, packages coming from China, I mean, they have taken such a long time in the transportation. I mean, you cannot expect that should be having a virus, because the virus has some kind of self-death time or whatever. Thank you.
Right.
Yeah. Viruses don't survive that long. This is Dr. A. Don't survive that long. So that's a myth. That's not the truth. Thank you so much. The next question is, how do I quarantine myself with other family members at home, Dr. Doshi?
Thank you. I think you have to take the same approach as you do with anything else. I'll just divide this into 2 or 3 different groups. If you are with the family and haven't gone out for 2 weeks, then there's no problem, and just follow the routine, hand washing and hygiene, personal hygiene. If any one of your members, a family member, is going out for whatever reason, then he should follow the same rules as coming in, wash your hands, and again, clean up all the areas that he has touched, like door knobs, door handles, so on and so forth. Now, another group that needs a little special attention, and that is the health care providers, who for whatever reason have to go to the hospital or to the clinics to help the present outbreak. And they are the one who, as soon as you come home, they have to change their clothes, wash their hands, again with 20 seconds normally. The clothes should be put into the washer dryer, and follow the routine. And again, follow the routine distancing, social distancing.
Thank you.
So, actually, can I add to that? Yeah. I think I'm wondering if the question was for how do we, if someone is sick with coronavirus, how do we take care of it, right?
No, how do we quarantine ourselves? It may be you're exposed, or you may be having symptoms. Yeah.
Okay.
Now, if I may continue for the last question that Dr. Thomas mentioned. Yeah, if somebody is diagnosed and he's convalescing at home, then he should be totally isolated in a separate room, and all his belongings, clothing should be totally different, separate, and food as well as other items needs to be treated very cautiously and following the hand washing principles.
Can I add to that?
And
the big thing is this is a respiratory virus, so I think the sick person should really wear a mask at all times, so that whatever droplets is coming out is actually contained and actually it's not going out to the air. Because they found that even micro droplets from even just talking it's in the air and it can carry the virus.
Thank you all. The next question is, what precautions can pregnant women take? Anything special, Dr. Kanumuri?
Thank you. I think pregnant women are at the same risk as general population, but there are different, I think there were 2 studies done. One is at Wuhan and one was at UK. And they said the complications or the childbirth, there was no difference. The children were all normal. There was no virus found in breast milk or any other secretions. And only thing, there was a small study in Wuhan said they may be immunocompromised, so they may have severe disease, but it's not clear, it's not sure. They're still studying on them.
And there is a related question from Ms. Biswal. For expectant mother, due date July, should OBGYN visit be paused in the interim since hospital visit is high risk? Any other at-home guidelines in the absence of doctor visit, outside exercise, walk, etc.?
I can give it a try. I think outside exercise, yes, people can go out as long as there's social distancing and not in crowded places.
Are you home or not?
But question is, the OBGYN visit should be discussed with their OBGYN, like what they think is safe. They should go with their guidance.
I can add to that. I can add to that. Nowadays you don't have to have for routine visit. You don't have to have an office visit. You can do telemedicine, and that is video connect. So if you have an iPhone and they will give a software to download, you can connect with your doctor. That's what we do with all our staffs now. So for routine visits, you can have video connect and telemedicine. So I would encourage you to explore telemedicine with your doctor. And these are for routine checkups.
It also can be done with the fetal monitoring too.
Yes. Thank you. The next question is, what precaution, child with asthma and taking steroid inhaler, what precautions should be taken?
So the guidelines from the American College of Allergy Immunology was anybody who has moderate to severe asthma or people who are on their inhalers not to change, even though they are steroid inhalers, to stay the same, because they're also at same risk as any other person. So they have to continue the avoidance guidelines that everybody is going to be following. But on the same token, if they do get the COVID, I mean, the disease can be severe because COVID also affects the respiratory system. But if you're already taking a steroid inhaler on it to maintain your asthma, please keep it on to maintain your symptoms under control.
Thank you. The next question is, does Flonase cause prolonged viral shedding?
So I think the question is coming from the fact that if you're on steroids, is your immune system suppressed and you will carry the COVID for a longer period of time? There is no study, or I haven't read anything on that matter. But on the same token, if you have your allergies, as long as you're doing the saline washes and you're using your Flonase, but you're maintaining or cleaning the top of the nose spray itself with alcohol after every use, that can keep the viral shedding or recontaminating yourself.
Excellent. Now we have a related question. You or anybody can take, Vijay, or will regular allergy medicine suppress COVID symptoms?
No, there is no evidence for that.
Okay, thank you. Now the next question is, students are being vacated from the dorm. Can I keep them at home? What precautions should I take? And Dr. Pradhan?
So yes, you can keep them at home. We all need each other's help at this time, but same precautions like you would do with your own kids. If they don't have symptoms, you don't have to worry about it.
Thank you. Now the next question is, I had previous TB infection that has healed. I have some scars in the lung. Am I at higher risk for COVID-19? Dr. Kanumuri?
Anybody is at risk as long as there's exposure. So following the precautions is always advised. But because of the tuberculosis, I mean, there's always some damage or fibrosis to the lung. So as a result, if you are infected, yes, you're at high risk of getting more complications from the COVID itself. But there were some studies from India that said they may be more protective. People who had TB have more natural killer cells and maybe more protected from the COVID, but I don't think we have enough evidence.
Thank you. The next question is, do I have to have all the symptoms, or are some symptoms enough to seek help for COVID? Dr. Nalani? Dr. Nalani?
He's muted.
Yeah,
Oh,
I guess I can take it, yeah.
yeah.
Oh, she's in. Okay, go ahead.
Okay. Yeah, she can add after I'm done, maybe. Okay.
Go ahead.
I guess the key symptoms, cough, fever, and trouble breathing. That should be the main focus of anybody calling in sick. There may be other symptoms like sinuses, diarrhea, which kind of can throw you off. But the key is, as soon as you get symptoms, call your physician so they can go over your symptoms and hopefully tease it out and see what you have. Because in spite of all the COVID, people will still get sinus infections. They'll still get gastroenteritis. They'll still get the other things. So the big thing is to kind of gather your symptoms and call your physician so they can go tease out the symptoms. Yeah. So the big main the symptoms would be like fever, cough, trouble breathing. Yep.
Excellent.
Someone
Thank you. Thank you so much.
I think someone else wanted to add to it. Yeah.
I think we are good. So the next question is by Mr. Sushant from Georgia. Can weather play a role in COVID-19 spread like in summer or hot weather? And will it help to reduce its effect and spread? Dr. Nalani?
Yeah, so there is actually no evidence so far that the virus, the effect of heat or humidity or any UV light has any effect on the symptoms. So in other words, the virus can spread in any climate. So at this point, we have no evidence that hot weather will decrease the prevalence of the virus.
Excellent. Thank you. The next question is there a mutation happening? You can answer that, Dr. Nalani.
Yeah. So yes, the answer to that is yes, this mutation is happening because that's the nature of the virus. Once the virus does go into the respiratory tract or your nasal passages or the lungs, it duplicates and replicates and undergoes some structural changes. So we do have mutations, but so far we did not see that these mutations will cause any new infections. There's no evidence to state that. There was a very, very, very small study of probably 100 patients, which shows that there are two main strains, the L strain and the S strain. And the L strain is a little bit more virulent, but we're still waiting for further studies.
Thank you. Now, there's a question, how risky is it to spend time by the seaside? Who will take that question?
If you are already there, then
yeah,
there is no problem
this is the seaside that I'm showing. So, since you guys are talking about weather, staying outside, yeah, is the seaside okay to go and then have fun there?
If you are already there, that is fine. But it is the risky is how you get there.
Oh.
And that's the main problem.
I'm still inside the window, but can I go out and have fun?
No.
Okay.
No. That's a funny question. That's a fun question.
I have another fun question.
Go ahead.
This is for maybe even audience. Okay, coronavirus, so beautiful, looks so beautiful. Is this, it looks like from the statistics, it affects males more than females. So is the coronavirus is female or male?
Looking at the color, it looks like female, so it's attracted to you, Anil.
Oh wow! Okay, I need to be careful. Okay.
That's a good one.
Okay.
Excellent. Now I have Anil, I have a question for Sarita.
Okay.
Because she answered that question. So if their social distance is 6 feet, how Sarita and her husband are adjusting at home?
We are in different room.
Thank you, Sarita. Okay, let's go to the next question. If one has to travel by air, what steps to take?
It's easy. Don't travel.
You should not be traveling. That is one of the reason, and that's why I just picked up that question.
I have a travel question here.
Sure.
Since everybody's home, the kids are home, we are home, why can't we go for the school camping?
Oh my goodness, no.
So any audience also wants to answer, please go ahead.
Yeah.
Then we'll ask our experts maybe.
What Anil is asking, kids are home, parents are tired of babysitting. So why don't we take them in the car and go for a camping? Any response from the audience?
May I add something here? So,
Yes. Yeah.
we are from California, and here the stay-at-home or shelter-in-place order categorically says that you can go out for essential events and for fresh air. So that being a stand by the government, I imagine for fresh air you can go out. So I normally take a walk outside for fresh air, whether I'm walking on the street or walking in the sea beach, like somebody asked a sea beach question, or I'm going in the camping, that is all right. As long as you do not mix with people, social distance is maintained. In a walk situation, it is very easy. You can stay away from people, but on a beach, it is difficult probably. On a campground, it is difficult probably. So you have to make a call for yourself. Are you able to keep yourself isolated as well as you're enjoying the outside weather? If you can do so, it is good. Otherwise, if you're not sure, don't take a risk. As simple as that. Thank you so much.
Great. Thank you, Manoj Babu.
Thank you so much.
Can I add to that?
Yeah, please,
Yeah.
Thomas.
Yeah, thing is, the only thing is you can go camping, but make sure you don't get stuck there, because with the police guys around, they don't want to kind of let people roam around too much. And there's nothing like home. Home is the best.
That's a great point. Thank you, Dr. Thomas.
Thank you.
By the way, talking about the police, I just want to add something. This is real. I mean, this is the actual fact. In California, we have plenty of sea beach and coast and stuff like that. Police has gone out in San Francisco County and they have locked up all the parking lots on the beach. Basically, they're officially telling people, hey, don't make any risky steps. People are against it because they want fresh air, but all beach parking lots are locked down. So you go there, I mean, there is no way to park. So, basically they're dissuading people to go out. That's it. Thank you.
Thank you. Let me take some more questions we have. If there is fever, people take paracetamol and ibuprofen, but the later one is not recommended. How do you deal with the fever?
Yeah.
Anybody wants to take it?
Paracetamol should help with the fever too.
Okay, so you recommend Tylenol?
Yes.
Okay, thank you. It's hard to wash berries. How do you wash the berries? Berries, Koli.
Yeah, you wash them the way you would wash any other vegetables before you eat them.
Like for 20 seconds, right? 20 seconds thoroughly. Yeah. Now, if I am diagnosed with COVID-19, can we ask for experimental drugs like hydroxychloroquine, etc.?
Yes, you should. Your provider should be able to prescribe it for you if you're having symptoms. Even though it's experimental, it's official that since we don't have any other better option, we're using it.
Right.
Plus
hydroxychloroquine has shown to be safe and being used in other conditions. So once the doctor checks your risk factor, any indications, contraindications, they will be able to prescribe. The next question is, when will the virus reach its peak in US? Vijay, you want to take it, or Sangeeta?
Yeah, I guess yeah, that's a great question. Thing is, everybody is speculating, but I'm kind of guessing it'll take at least 8 weeks. So the prediction is maybe by June we should flatten it out, or maybe by mid-May. But it's just a guessing game, because the more cases we see, we'll have to kind of see the case come, and hopefully if there's more of herd immunity, like a lot of the sick ones who are kind of not that sick, like 80% of the cases will actually get better without much treatment. So once we have more of that population, there'll be less transmission, and I'm kind of hoping that'll flatten it out really fast.
Thank you.
So I'm expecting maybe May, June at the
Right.
most. Yeah.
There's a related question from Mr. Sunil Sabat. How will the pandemic end? Best and worst case scenarios. I think you explained, right? How will the pandemic end, and what's the best and worst case scenario? I mean, what I would say is, I would add to Dr. Thomas, the pandemic, we are expecting, we're doing all the steps, necessary steps US is taking, though we are a little bit delayed in diagnosis, but it hit us hard, and before we were aware, and now it's already in. So now we are taking all the necessary steps, and we hope to have it in control, like Dr. Thomas said, by May. And that is only the best case scenario. We would not think about any worst case scenario at present. I would like everybody to stay optimistic on this, and we will get over it. Now, the next question. Yeah, go ahead.
By end of May, there'll be a lot of recovered COVID cases. So definitely, we can use a plasma for the sick ones. I think we can put a handle on it. Yeah.
Thank you. There's another question from Bhavani, Georgia. Are there some diets other than vitamin C that help build immunity? I think Sangeeta can take that for the treatment side.
So basically vitamin C, D, and zinc, those are proven. C works by stabilizing your mucosal membranes, and D boosts your immunity. Same thing with zinc, it boosts your immunity.
Okay. There is, and thank you. There's another question from Bibu.
And the big thing to add to that is the food. The food is critical. So we need to really kind of make sure that we have a lot of fruits and vegetables, all the colored fruits and vegetables. The one thing is folks can actually go and Google immune boosting diet. And that has a lot of easy things to follow, and kind of just do that more and add some vitamin C and D and zinc. Yep.
Excellent. Now I will ask Utkal, do we have some more time for a couple of questions, Utkal?
Yes, yeah, we have time.
Okay, thank you. So now the next question is from Bibu, Georgia. If someone had other infections like flu or viral infections, will they recovery from the same produce antibodies to help to fight COVID?
Unfortunately not.
And I know Bibu, chicken and mutton is different. Okay. The next question is there any possibility COVID may reappear in 2021?
Yeah.
There could be, because of the new mutations, appearing. There could be, although we are not certain at this time.
Awesome.
Yeah. Can I add to that? Yeah, I can add to that. The thing is, this is an RNA virus, so RNA viruses tend to mutate some. So we might see a little bit of change. It may not come next year, but the year after. So the big thing is to kind of hopefully create some vaccines if it's possible, and kind of do the best we can.
Let me add a line to that. I think Dr. Fauci also said that we can see seasonal cycling soon.
Yes. Yeah, he had mentioned that we should be living it like a seasonal flu from next year onwards.
Yeah, once we have the vaccine, I think add it to your list of immunizations, annual ones with flu, another shot.
Now the next question is to Dr. Mishra. Is alcohol wine good or bad for the virus?
I don't know for the virus. For the human beings, definitely good. It will calm your nerves in panic situations. Most of our WhatsApp guys are on it. But no, I mean, there is, as I said, 70% alcohol kills the virus, but then it's not necessarily that you take it and you are protected from the virus. No.
It dehydrates you, it's a diuretic. So people think, oh, we're drinking liquid, but that's not.
Yes. On a serious side, no, shouldn't.
Is gin and tonic good? Like, is a replacement for maploquine?
No.
No, alcohol can never be good.
When you come here, Sarita, I will give you. Don't worry. But not now, though.
Sarita, maybe vodka is good, not gin.
Yeah, vodka is good. Yeah. So I had a question. So I think I can ask that. So somebody taking lisinopril Lisinopril and Jardine, all the diabetes medicine and Astrobin. Is it going to suppress the COVID? I think doctor said, I missed that part in the beginning. Lisinopril.
Lisinopril. Okay,
Lisinopril. Sorry.
Yeah. Yeah, lisinopril actually, it's in the ACE family, which they say that those who have been on lisinopril for a while, they tend to have the ACE2 receptors on the cells at a higher rate. So it's easy for the virus to get in if you're on lisinopril, but the CDC does not recommend that we get off it. I know I've got patients who are concerned. They call and tell me that, hey, I'm on this medicine, what can I do? I do switch them out to a calcium channel blocker. And even though you make the switch, you may not see the difference right away, but I'm assuming in the next 6 weeks, the receptors will kind of slowly regress itself and go back to the baseline. So it may not help them right away, but maybe 6 weeks from now, they may be better off when they get COVID. So the switch can be made, but the CDC does not recommend it.
Thank
you.
Does that answer the question? Yeah.
How about metformin? There are two drugs, metformin and how about statins?
Metformin metformin I think has no concerns. Statins have got no concerns, but they did find that the diabetic medicine, the pioglitazone, that's Actos family, they do have the same issues that lisinopril might carry, but again, there's no guidelines to stop it.
But the statin has been shown some benefit as an antiviral activity.
Right. That's what he said. Yeah.
Okay.
Now the next question is, Vikas can take
now,
this.
can I add to that one more thing? Yeah.
Sure, go ahead.
So I think as Dr. Agrawal mentioned, losartan is actually being looked at as, they're doing trials on it. So I would definitely switch my lisinopril folks to losartan if they want to make the switch. So that's an option for them.
Thank you. The next question, because what are the early symptoms and when the earliest it can be seen? I think we have answered that. You can just refresh.
The most important symptoms, about more than 90%, is about fever, then cough, and then shortness of breath. And those are the three most important symptoms. The earliest you can get within about 3 to 5 days of exposure.
Excellent.
And that is, so, if we really need to find out, how we are doing, get a temperature and get a pulse ox at home, which is very inexpensive.
Thank you. Now, there's a related question to that. How long can I reuse the mask for the hospital or staffs or the people, they have a mask? How long can they reuse the mask?
Since there's a deficiency of the N95 masks or the surgical mask, actually they're implementing that we can use it, you can reuse it. And they're also suggesting that you can use cloth masks so that you can wash them and use them. Now, if you do have to use the surgical mask or the N95, it's suggested that you don't touch the inside of the masks. And they're also saying that because of the lack of the masks we have right now, put an inner lining to it and continue to use it.
Okay, thank you. There's another question. Is it okay to take ibuprofen now if you don't have any symptom or concern regarding the possible exposure to COVID?
I would still not use it.
Yeah, and what I would add is at this juncture, when we are going through a crisis, if you feel like you want to take something for fever, we would prefer you to take Tylenol. After this period is gone, you can do whichever medicine you can take. And the next question is, give me, I'm just, one question I could not. Appliance in cell phone for temperature. Is there any appliance in cell phone applications for temperature recording? I don't think so.
I don't think so.
Do you use hand sanitizer, thermoscan for temperature? Yes, we use thermoscan for temperature, non-touch technique. We do that in hospitals nowadays. Now there's one question I would like to take it. All presenters are saying, don't panic. The title of this session, COVID-19 Apocalypse, is however not in that spirit and does monger fear and panic. Please clarify if you really think this is an apocalypse. So what I would say to the questioner is, apocalypse means causing destruction in large scale. So the thing that we are seeing when we are calling it pandemic with large scale destructions, and if you see the number of dead bodies in Italy and other places, and how in China they had incinerators and burning bodies to prevent further spread, this is no less than an apocalypse. So the title of the topic, COVID-19 apocalypse, is the current situation we are going through, large scale destruction due to COVID-19. So this is not a fear monger, but this is just to raise awareness among the people, the seriousness of this virus, how deadly it is, how the symptoms spread is so insidious and spread so rapidly. By the time you realize within 24 hours, your whole lung is gone, and you'll end up in the hospital getting intubated when there are shortage of ventilators. So this social distancing and doing all this step is paying respect to each and every family and each and every ODA family also, which we are focusing on here. This is of grave magnitude, and I would request the questioner to rethink what he has said. And if he again thinks it's that, we apologize for his perception, but this is a very serious situation, and that's why we decided to get awareness and spread the information wide to each and every person. Thank you. I think we don't have, go ahead.
No, I wanted to thank the OSA Health Wellness Group. It's really informative. Thank you.
Can I ask a last question, Dr. Ray?
Sure.
I guess for the panelists, what's the dose of vitamin C, vitamin D, and zinc you recommend?
So vitamin C is 1000 microgram every day. Vitamin D, for those who are not deficient in vitamin D, if they already know it, then it's only 2000 international units daily, and zinc is 50 milligrams every day.
Yeah. Are there any more questions, Utkal?
Yeah, there are a few more.
Okay, so we can take that one. I see here, Mishra. What about acid blockers like pantoprazole? What do I do if I am on it?
There should not be any problems with the acid blockers. We should be able to continue that, pantoprazole.
Excellent.
I think, can I add to that?
Sure.
Yeah, I think pantoprazole, I think there was a concern for ICU patients, like those who are on long term, they tend to, they're more susceptible to pneumonias. So the question is, of course, if you need it, definitely take it. If you can do without it, is always better. But I mean, some can do without it. So you don't really need to be on it if you don't have symptoms, unless really you have Barrett's disease and the physician said, yeah, got to be on it. But if you can use it as needed, it's always better.
Yep. Thank you. There's one question here. This is for Dr. Mishra.
Yeah.
India related. I know we talked about the effect of weather. Somehow there is this belief that India has been somewhat spared because of heat. However, is it possible that the low count is mainly because of lack of testing, or in some case because it's not being reported? The thought of the virus spreading in India is scary because of the sheer number and the lack of infrastructure.
Yes, I agree to the last part that it's scary. If it spreads, it will go in millions. The first thing is regarding temperature. We discussed that there's no evidence to show that in summer it will die out. We are all hoping, because Kerala is a very warm state and it has high number of cases. Thailand is a very warm country. It has also a high number of cases. So that's out. Low testing, yes. The government has advised for judicious use of testing. They are more focused on screening the people and quarantining them rather than doing a mass screening. But now the testing has picked up, so more tests are being done. But I still think it's not really very underreported, because the next few days will tell us exactly what's the picture like.
Thank you so much, Dr. Mishra. There's one question I have here. Do you suggest to delay our OSA convention? From the medical aspect, I'll take it, and from the organization aspect, I'll leave it to Mr. Anil and Kuku. From medical aspect, I would say it is too early to cancel any event, because that is in July and we are now in end of March. So we still have time, and let's see how it progresses. And you can have both the things planned and progressing simultaneously while we are watching this. if it happens, it happens. From medical point of view, at this time, we would not recommend anything canceling or going for it. And I'll pass it on to Mr. Anil and Ms. Kuku for the organizational aspect.
Yeah, great. Kukova, you want to take it?
Nishcha, thanks for asking the very good question. As Dr. Ray is saying, we are taking the major steps looking at the situation. Of course, केमती परिस्थिति सेतबळे हबो सेही अनुसारे हमें डिसाइड करिवो. For July 4th, so far we stopped taking any further action, but still it's on. देखिवा कौन होच. निश्चय situation को देखी के will take. अगर जान है तो जहान है. So of course.
The internal discussion is still going on. I mean, we are still working with the convention committee. We are still working. So we are watching, keeping and watch, and we have this wonderful health wellness group to doctors to talk to and evaluate the situation as we go further.
Excellent. Now, I think Utkal, do we have any more questions?
I think yeah, I got another question from a different source. It says that do we have any recommendations on freezing vegetables from the grocery store to help us in decontaminating?
Dr. Doshi, Nitin, do you want to take it?
I would avoid it because once you put it in the freezer, you are letting the virus survive longer. So if at all there is any virus left on the vegetables which were not treated by yourself or even at the store, it's better not to put it on the freezer.
Thank you so much. So I think we are done with the questions, and I would just briefly thank you all the participants and the audience, and especially Dr. Mishra logging in from India. And I will hand it over to Mr. Anil Patnaik, the thank you note on behalf of OSA. And then Ms. Lipi Manti will do the thank you note on behalf of OSA Health and Wellness. Thank you all, and God bless.
Thank you, Dr. Ray. It just is overwhelming to see that our experts from OSA and OSA Health Wellness Group. So I see ki इतने सब सुंदर discussion कल the question and answer in this time of this anxiety and all, like it's so wonderful to have you all here. We know that you all are so busy during this emergency situation, but even with that, you are giving your precious time and advice to all of us. We really are proud of you and proud of having these experts in our own Odia community, giving so detailed answers to our questions. And in fact, if I conclude, OSA Health Wellness is really the key for this OSA and the whole community. Thank you all. Thank you to all the panelists. Thank you, Dr. Ray. Thank you, OSA Health Wellness.
Thank you so much.
Dr. Sabendra Mishra from India.
Yeah.
Thank you so much. Thank you. My pleasure.
I think the questions were very relevant, and thank you for answering them. So that was the whole purpose of setting this up, and we thought the questions were very, very relevant. So thank you all for taking the time to answer them.
Thank you so much. And I would like Lipi Mahanti to give the thank you note on behalf of OSA Health and Wellness. Lipi, go ahead.
Good afternoon, everyone. On behalf of the OSA Health and Wellness Group, I would like to thank OSA Executive Committee members, Ms. Kuku Das, Mr. Anil Patnaik, and Mr. Utkal Naik for inviting us to the COVID-19 question and answer session. My sincere thanks to our audience for taking part in the session and asking questions. I hope our panelists were able to clear some of your doubts, and if you have any further question, we can have another session. So please send us your feedback at osahw@odissasociety.org. Again, the email ID is osahw@odissasociety.org. I'd also like to mention that the government, healthcare workers, and other frontline workers are making a lot of sacrifices just to save our life and keep us safe. So please let us be show our gratitude to them and stay home and stay safe. Thank you.
Stay well and stay safe, everybody. Thank you.
Thank you all. Thank you so much.
Thank you.
Stay safe. Bye.
Thanks, Amarendra.
All right.
Thanks, Amarendra.
Thank you all.
Thanks.
Thank you.